For over a month now, Donald Trump has been alluding, jokingly, to the idea that he thinks that we're testing too much, that testing should be shut down, that the only reason we seem to have so many coronavirus cases is because we're doing so much testing. He called it a trap yesterday in an interview to do testing. But the thing is that the tests are out there. They're being done, and there are multiple organizations collecting all of this information and then disseminating it so that we have as good of an idea as is currently possible of what the state of the pandemic actually is. That was yesterday. Going forward, who knows? Because the Trump administration has ordered hospitals to bypass the Centers for Disease Control and Prevention and send all COVID-19 patient information to a central database in Washington beginning on Wednesday, today. From now on, the department, not the CDC, will collect daily reports about the patients that each hospital is treating, the number of available beds and ventilators, and other information vital to tracking the pandemic, or concealing the tracking of the pandemic. Officials say that this change will streamline data gathering and assist the White House Coronavirus Task Force, which still exists, I guess, in allocating scarce resources like personal protective gear and remdesivir, the first drug shown to be effective against the virus. But the Health and Human Services database that will receive new information is not open to the public, which could affect the work of scores of researchers, modelers, and health officials who rely on CDC data to make projections and crucial decisions.
Yeah.
And to that I add, adoy. That's the idea. Now, obviously, they have to be, this is the New York Times, so they have to be very New York Times-ish about it. But yes, that's the idea.
This checks out with everything and approach that this administration has done on so many other important things. So to take over, basically, administrative purposes of a whole complete department agency within the administration, like the CDC, and then centralize it to some secret database where you control how it works to do things like track, determine the number of deaths and sicknesses, and then allocate funds and control the use of the potential vaccine. So if you do all this, and you've always been against the information about numbers of cases and numbers of deaths. You've been against certain remedies, certain vaccines, because you're pushing other things like hydroxychloroquine because it helps you and your buddies, whoever else is behind it. When you say testing is a problem and we need to suppress testing, everything you've already told us that you look to control now with this, you don't want people to have that information. So it's pretty obvious what you want to do with this information. And again, it's happened before with the Consumer Financial Protection Bureau that Elizabeth Warren started back in the Obama days. And then when they came into power, they put someone in place to stifle it. The environment of the EPA, they put someone in place to stifle it. Every agency that they put someone in charge of, if they take over, they're looking to stifle that particular agency's mission. This is just another version of that.
Exactly, and potentially a very powerful one. Now that's JR's opinion and my opinion. What do we know? We're not doctors, so let's turn to the doctors, like Dr. Nicole Lurie, who served in HHS under President Obama, who says, it appears to cut off the ability of agencies like CDC to do its basic job. Now, I could show you so many instances of doctors and people who formerly served in the CDC and HHS who are saying the same thing. It's all out there. If you want to see it, go see it. But they're all saying the basic thing. There is obviously the potential for information to be concealed through this. And we would have no way of knowing it because it's not open to the public. What benefit is there? I don't know. They're saying it will allow the government to respond to changes in the pandemic. In what possible way is the information going directly to HHS better than it going to CDC, which is literally designed to anticipate and respond to pandemics? I don't know. Maybe there is something. Again, I'm not a doctor, but it's not being articulated. And when you have someone like Donald Trump, who has been complaining about the success of testing so far for months now, why would anyone extend any goodwill towards this administration? We've been given literally no reason to. And bear in mind,
explanations aren't given.
No, nothing. And this is the most recent thing, but the order that we just talked about, that came just hours after 4 former directors of the CDC wrote in a Washington Post op-ed that, quote, no president ever politicized the CDC science the way Trump has. To that I say, well, be careful what you wish for, because you guys complained when he politicized CDC science. Now he's just cutting the CDC entirely out of it. So there, you can go have your science. But they can't have any science, the CDC, not from hospitals anyway.
Yeah.
Now, it leaves certain questions like, so I and many people follow a Twitter account called COVID Tracking Project. They appear to get their information from individual states. It is possible that some of that might still exist, assuming this order doesn't stop the state health departments from communicating with groups like COVID Tracking Project. But in terms of official government tracking, it will still exist, and it is possible that our fears won't be borne out. But it could be that things turn dark after this in terms of access to information. And if it's the case, we would have no idea. We will just have to accept whatever numbers they put out. We'll have no way to directly question them because they have access to all of the information and we don't.
It doesn't sound like much of a free country, or at least free. What did Trump say? He's going to have the most transparent presidency, most transparent administration in history, because now you're ready to close off all information. Let's not forget his favorite governor, or one of his favorite governors, Ron DeSantis down in Florida, did the same thing. He was hiding numbers that were happening at nursing homes. He was hiding the general numbers in the state overall, as they complained, and then said that numbers that were coming out that were attributed to COVID cases and COVID deaths were being manipulated, changed, blamed. Like they said people would die of something else, so they would just say it's COVID, and they would start exaggerating and say someone hit their head, and then they said COVID. So this is their approach. They're looking to downplay and suppress all of this. It's not hidden. It's not like we're speculating. They said so.
Exactly. Yeah, and now it will be hidden. No, when we said we wanted transparency in government, we weren't just talking about Stephen Miller's skin. We mean in terms of access to information. We want you to be honest and upfront and not corrupt. And so if they think that the states or the CDC were classifying some deaths as being coronavirus when they don't think it should be, because, the person had coronavirus and their lungs failed, but they also had diabetes. Yep. Well, the CDC's been counting that as a coronavirus death. Will HHS under Trump? I don't know. I honestly don't. I have no idea. Yeah. And we won't even necessarily know if that's what they're doing or not. Anyway, the entire thing is so frustrating. And again, in terms of when you see a move like this and you have to make the evaluation, should I extend goodwill? Should I wait and see? Remember that in terms of other government efforts right now having to do with the coronavirus, what is the main thing that the White House is doing? It is smearing Anthony Fauci, including with Peter Navarro's op-ed that just came out today, attacking him. That a senior White House official tells reporter Catherine Falders Navarro went rogue and put out his personal opinion without any approvals. That happened. That's what it was. It was just him. Oh, and also Kayleigh McEnany, who's been attacking him, and the multiple people in the White House who leaked that bit of Oppo research against him, and Trump, who's been implying that you can't trust all of these doctors, and all of them, rogue. It's a rogues gallery. That's the thing.
Somehow Peter Navarro went rogue and I know you just listed this, after Trump said Dr. Fauci gets everything wrong, after they leaked the information that everything gets wrong, after Stephen Moore, there's the only one I think that you didn't mention, Stephen Moore, his group, says they're planning to put together an even larger thing to say that everything Dr. Fauci's ever said in his career has been wrong, and we're going to send that to the White House and let them have that for whatever purposes of campaigning or for destroying this guy's a standing in his character that they can, so they can continue to lie to the American people. And now Peter Navarro does the same thing, uses the exact same talking points and wording and phrasing, and that's rogue? First of all, if anybody goes rogue in the White House, we know what they do to them. They fire them, they persecute them, they go to the press and talk about how horrible a person they are, they're a disgruntled employee. So going rogue doesn't look like this. Going rogue is when you blow the whistle on some illegal activity, then you become public enemy number one. Going rogue does not look like the same thing the White House officially says.
Exactly. And in a White House with a president who values, like if you had a pie chart of what he values, 100% of it would be loyalty. You can't go rogue doing what he wants you to do. That's not how rogue works. I watched a lot of X-Men. I know how rogue works. Anyway.
Well, and also, I'm sorry, and last thing on this too is You think Trump wanted to tweet about how horrible of a person Peter Navarro is for going rogue and behind his back and not going through the normal protocol and processes for sending out an op-ed that's going to destroy someone, or that you're looking to destroy someone? Honestly, that's the last part. It's not even going to work.
Yeah.
Everyone already knows. We can see obvious truth and honesty versus, manipulation.
Yeah. For more political news breakdowns, interviews, stories of activism, and me trying my hardest to care about the occasional big celebrity news story, subscribe to our YouTube channel at youtube.com/The Damage Report. And you can ring the bell wherever it is so you don't miss anything.